Intracranial efficacy of Selpercatinib in RET fusion-positive non-small cell lung cancers on the Libretto 001 trial. We report the intracranial efficacy of Selpercatinib, a highly potent and selective RET inhibitor, approved in the United States for RET fusion-positive non-small cell lung cancers. In the global Phase 1 and 2 Libretto 001 trial in advanced RET-altered solid tumors, Selpercatinib was dosed orally, 160 mg twice every day, in 28-day cycles. Patients with baseline intracranial metastasis had MRI/CT scans every 8 weeks for 1 year, 12 weeks thereafter. In this pre-planned analysis of patients with RET fusion-positive NSCLC with baseline intracranial metastasis, the primary endpoint was independently assessed intracranial objective response rate, ORR, for RECIST 1.1. Secondary endpoints included intracranial disease control rate, intracranial duration of response, and intracranial progression-free survival, PFS, independently reviewed. 80 patients with NSCLC had brain metastasis at baseline. Patients were heavily pretreated. 56% of patients received is greater than or equal to 1 course of intracranial radiation, 14% whole brain radiotherapy, 45% stereotactic radiosurgery. Among 22 patients with measurable intracranial disease at baseline, intracranial ORR was 82%, including 23% with complete responses. Among all intracranial responders, median duration of intracranial response was not reached at a median duration of follow-up of 9.5 months. At 12 months, 55% of intracranial responses were ongoing. In all 80 patients, median intracranial PFS was 13.7 months at a median duration of follow-up of 11.0 months. No new safety signals were revealed in patients with brain metastasis compared with the full NSCLC trial population. Selpercatinib has robust and durable intracranial efficacy in patients with RET fusion-positive NSCLC. Brain metastasis frequently occur in RET fusion-positive non-small cell lung cancers, with an approximate 50% lifetime prevalence reported. Intracranial metastasis are a major cause of morbidity and mortality in this patient population. Thus, there is a need for novel RET-directed, targeted therapy strategies with high efficacy. Selpercatinib, a selective and potent RET inhibitor, shows compelling preliminary evidence of activity in patients with brain metastasis. This Phase 1 and 2 trial evaluated the efficacy and safety of Selpercatinib in patients with RET fusion-positive NSCLCs with intracranial metastasis. In this study, Selpercatinib was well tolerated, achieving high intracranial response rate and prolonged intracranial duration of response and intracranial progression-free survival. Combined, these results support Selpercatinib as a new standard of care therapy for the primary treatment of brain metastasis for patients with RET fusion-positive NSCLC.